Today we are going to discuss Pharmacy Act 1948. It is an act to regulate the profession of pharmacy, whereas it is expedient to make better provision for the regulation of profession and practice of pharmacy for the purpose to constitute pharmacy council. The act was promulgated in year 1948. The PCI was first constituted in the year 1949 and reconstituted every 5 years. The primary obligation of pharmacy is to safeguard the public health by making available right medicaments. The desired knowledge, skill, and training are provided through pharmacy courses. The next objectives of the Pharmacy Act. First, regulating and raising the status of profession of pharmacy in India. Then, providing uniform education and training to the persons. Then, maintaining control over the persons entering the profession of pharmacy. Then, constituent Pharmacy Council of India for setting new standards in pharmacy education. Then, to provide constitution and functions of State Pharmacy Council for registration of pharmacists. Then, regulate the activities of pharmacists. Next, Pharmacy Council of India. In January 2015, the Pharmacy Council of India has published the new pharmacy practice regulations to regulate pharmacy in India. There are some provisions. First, the drugs can be dispensed only by qualified registered pharmacist. Then, a registered pharmacist shall not give his registration certificate at more than one pharmacy. Then, a registered pharmacist shall also comply with the dress code by wearing white coat and apron with a badge displaying the name and registration number. Every registered pharmacist shall dispense only those medicines as prescribed by RMP, that is Registered Medical Practitioner. Then, every registered pharmacist shall maintain the medical records pertaining to the patient for a period of 5 years from the date of commencement of the treatment as per regulations. Then, pharmacists should promote the rational use of drugs and other guidelines regarding to ethical conduct of pharmacist. Then, next point is Constitution of PCI. The PCI was constituted on 9th August 1949 under Section 3 of the Pharmacy Act. First, elected members. 6 members, including at least one teacher, each in pharmaceutical chemistry, pharmacology, and pharmacognosy on the teaching staff of any Indian university or affiliated college. These members are elected by University Grant Commission, that is UGC. Then, one member elected by the Medical Council of India. Then, one member who shall be registered pharmacist to represent each state, elected by State Council from amongst its members. Then be nominated members. 6 members, including at least 4 persons possessing degree or diploma in pharmacy and engage in the practice of pharmacy or pharmaceutical chemistry, nominated by central government. Then a representative each of the UGC and all Indian Council for Technical Education, that is AICTE. One representative from UGC and AICTE. Then one registered pharmacist to represent each state, nominated by the state government or Union Territory Administration. Then C, ex officio member. First, the Director General of Health Services. Then Director of CDL, that is Central Drug Laboratory. Then the Drugs Controller of India. If the ex officio member under C, A and B are unable to attend any meeting, they can authorize a person each in writing to attend the meeting. The next functions of Pharmacy Council of India. First function is to prescribe minimum standard of education. Then drafting of education of regulations to be fulfilled by the institution for the approval for imparting education in pharmacy. Then to provide uniform implementation of the educational standards throughout the country. Next, the inspection of pharmacy institution. Then to recognize the course of study and examination for pharmacists. Then to withdraw approval if any institution does not conform educational standards prescribed by the Pharmacy Council of India. Then to approve qualifications granted outside the territories to which Pharmacy Act extends, that is approval of foreign qualification. These are the functions of Pharmacy Council of India. First one is the prescribe minimum standard of education, then drafting education of regulations, then provide uniform implementation of education standards, then inspection of pharmacy institution, then to recognize the course of study, then to withdraw the approval, and last to approve the qualification, that is the approval of foreign qualifications. Next, to compile and maintain central register of pharmacists. President and Vice President of Central Council. The President and Vice President of Central Council are elected by the members of Council from among themselves, and they hold the office for a period of not exceeding 5 years. And they are also eligible for re-election. If the term of President or Vice President as member of the Central Council expires before the expire of that full term for which he is elected, he is re-elected, renominated as a member of Central Council. Then elections are to be conducted in the prescribed manner. Then terms of office and casual vacancies. Any nominated or elected member shall hold office for a term of 5 years from the date of his nomination. A nominated or elected member can resign his membership by writing under his hand to the President. Then a nominated or elected member shall be deemed to have vacated his seat if he remains absent without sufficient reason to the Central Council. A casual vacancy in the Central Council shall be filled by fresh nomination or election. Members of the Central Council are eligible for re-nomination and re-election. Next, the Executive Committee. The Pharmacy Act provides constitution of Executive Committee by the Central Council. The Executive Committee consists of first ex officio members. In that, first one is the President, who shall be the chairman. And second, Vice President. These two ex officio members. Then 5 other members elected by the Central Council. The members of Executive Committee holds the office until the expiry of his terms as a member of Central Council. But if re-elected as a member of Central Council, he can hold office for residual term. The next, powers. Powers of Central Council to make regulations. The Council is authorized to lay down the rules for its procedure, fix the rate of allowance payable to its members and members of other committees which are previously sanctioned by central government. It also laid down the rules for the management of its property and maintenance and auditing accounts. Then the Council may constitute from amongst its members. The Council has to furnish copies of his minutes and those of Executive Committee, together with a summary of annual activities and accounts to the central government. Central government may publish any reports or abstract in such manner as it thinks proper.